Hello, sir. Do you know that your untreated infection can make you to have low sperm count? Yes, it can make you to have low sperm count. You know, the whitish fluid that comes out during sexual excitement is not all of them that is sperm. The sperm is a cell, it's a tiny cell. It has a big head and a small tail, tiny tail. It is the tail that helps it to swim. Okay, so the sperm cell is produced in a separate place. The whitish fluid you are seeing is produced in a separate place. Some nutrients. Now, let me even tell you the entire fluid you are seeing there. Let me analyze it for you. It contains the sperm cell, it contains carbohydrate, it contains protein, it contains lubricants, it contains other materials that help to keep the sperm alive. Okay, the sperm cell alive. Okay, so now the sperm cell is produced in a place where we call the testis, your balls. It is your balls that produces the sperm cell. So after producing them, they will now transport it into another tube that is called epididymis. That is where they will now stay. They will mature and grow up and be waiting for the day they will come out. Okay, so the whitish fluid you are seeing is produced in another place. The carbohydrate, the nutrients, every other thing, they are produced in separate places. Glands, there are so many glands inside the reproductive tract of a man that produce those things. Now, during sexual excitement, the sperm will leave the epididymis. It will travel from a tube. The whitish fluid, the lubricant will come out of a fluid. Those other nutrients will come out. They will go and meet in a junction where they flush out at the same time. And that is what you call the sperm. Okay, that is the fluid. The entire fluid you are seeing is not all of them that is sperm. It contains the sperm cell and every other nutrient. Now, how does your infection cause low sperm count? Now, if you have infection, say gonorrhea, chlamydia, trachomatis, and every other orchitis and others, if you have this infection, what do? They can change the morphology of the sperm cell, where it is now, the sperm that has been produced, it is there saved. It can go and change the shape of the cell. You know, the sperm ordinarily has a big head, a rounded head, or oval-shaped head and tiny tail. It can go and change the shape of the sperm. Maybe it can make the head flat, or it can make the head even bigger. It can just change the shape anyhow, so that the sperm cannot move well. It can change the motility of the sperm, so that if it swim well. Okay, it can make it, even the tube where it should travel to, it can block it. If you let it pass, the tube can be blocked. Okay, so now during sexual excitement, instead of the sperm to swim out to go and meet the mate and come outside, it will be trapped there. It no go fit come outside. You understand? So even though your whitish fluid comes out, the sperm will be missing because the infection you have has blocked it from coming out. It has either changed the shape, it has either affected the motility, it has either made the tube where it should travel to be swallowed, so that it is not able to travel. It would come tiny. Instead of normally the tube supposed to be like this so that the sperm will fit pass through, but now it don't tight. The sperm no come fit pass through. So during your sexual excitement, the fluid that comes out, you might think is all the sperm is missing. So when they now test the fluid, they now tell you have low sperm count. Indeed, because the sperm that is supposed to come outside did not come out. It was trapped. It was not able to swim out to go and meet the fluid, the semen, to come outside. You understand? So this is how your infection, untreated infection, can make you to have low sperm count. So it is possible, it is 100% possible for your for your body to produce the adequate number of sperm. Your body is producing the right number of sperm. Your sperm, everything is working well, but it is there, it is trapped. It no go fit come outside because the tube is blocked. Okay, the tube is blocked, or the sperm cannot swim well, or the sperm shape has changed. So this is what infection can cause to your body, so that the sperm is not able to come out to meet the semen. The sperm is not able to come out to meet all those nutrients, so that it can come out together with it. So when they now test the entire fluid, they now see that the sperm cell, they are scanty, they are missing. The scanty ones are the ones that we're able to, they manage, they struggle, pass through the tiny the tube, even though it was tight, they pass through, they can't come outside, they force their way through. Or the ones that were able to come out, they, even though they were sluggish, they don't feel fast, they move small, small, move small, small, they can't feel join, come outside. Those tiny ones, they can't test and they can't say, you have low sperm count, it's tiny, it's scanty, because a number of them were trapped there, they don't feel come outside. So this is how infection can make you to have low sperm count. So sir, I beg you, please treat your infection.